and welcome to What It Takes. I'm Tom Landon. For decades, the Child Health Investment Partnership of the Roanoke Valley, better known as CHIP, has given parents and their children access to needed medical services and developmental education. The goal is to provide support to families as they set and reach goals to become self-sufficient. Last year, the organization began searching for a replacement for longtime leader Robin Haldeman and landed on Rachel Hopkins, formerly with the Science Museum. Today, I'm pleased to have both Rachel and new hire Nikki King, who is the new Director of Program Services. CHIP's an organization that's been quietly working to help children and families. I'm excited to give you all place here today to tell the CHIP story. So I always like to start just by asking people, how you got to where you are. So Rachel, I know a little bit about your story, but how did you end up coming over to CHIP to take on this new challenge?
Yeah, so I knew that I was ready to switch gears, and it's interesting because a lot of people I think are surprised, like science to CHIP. The thing is what's at the core of both and really any business organization is relationships. So CHIP is in the business of relationships. I was really attracted to that. I looked at the folks that have been volunteering on the board involved with the organization, and I noticed, wow, this is a group of wonderful, amazing people, and it doesn't change. So that's how I ended up at CHIP, and I'm so very glad I did. I'm coming up on my almost my first birthday, so yeah, happy to be here.
And Nikki, you're a little newer. Now, you and I have known each other for a little while from your work elsewhere. I know you came here from Indiana. How did you, we're so glad to have you in Roanoke, but what convinced you to come to Roanoke to work for CHIP?
Well, something that I'm really passionate about in my work is innovation and constantly sort of challenging the way that we've traditionally looked at healthcare to try to break down barriers and really meet folks where they are and help engage them. And I had a friend who had mentioned to me that CHIP was actually really in line with that, and so I checked it out, and I immediately fell in love with their mission and the team and just the overall vibe, and I thought this is where I got to be.
Well, we're very happy to have you here instead of Batesville, Indiana. Rachel, this question is going to go to both of you, but first impressions upon arrival at CHIP, like you kind of knew what you were getting into, but when you actually arrived, what did you think?
Well, first off, I would say for the first month at least, I would go home and need a lot of time to just decompress because I thought the people I work with are amazing. They do this day in and day out. The families that we work with are amazing. I work with such strong people, and I 100% worked with strong people at the Science Museum, but I think you get comfortable, you get used to an environment, and I started at CHIP, and I had to have, that was my first impression, the work that they're doing, and as Nikki said, the innovative manner, which really isn't, it's relationship, right? It's trust, a trust-based relationship, and so for me, I thought this, I've landed on a dream job, and it might be the hardest job I've ever had, but I was just blown away. And also, you learn so much. It's just a wealth of information. It's layers and layers to the work. So I spent a lot of time just reflecting and trying to absorb as much as I could that first month.
And Nikki, I know in your work for your doctoral degree and other things, you've really looked at, you've been enmeshed in healthcare. This is a different sort of approach to providing that care. So as you walked into CHIP for the first time, I know you're a doer, so but what were your thoughts as you walked those halls at first?
I think that one of the biggest things that actually struck me as very different is the entire organization from the top to the bottom is so trauma informed. And I think sometimes we really get away from that in healthcare. We talk a lot about childhood trauma and its predictive effects on how happy people are going to be and the rest of their health, right? But oftentimes, even though we tell that to our patients in healthcare, we don't practice it ourselves. And when I got to CHIP, it was one of the first places that I really, really felt from top to bottom that this entire vision was very embraced, not just in how we treat our clients and the families that we work with, but also the team environment. And I thought that was really refreshing, and I was just excited to kind of hopefully contribute.
I do want to talk about like the actual work that CHIP does, but I know one other thing that just strikes me organizationally is you guys are both coming into an organization that was led by a strong leader for a long time. And I'm sure that change is in the air, even though there's great things to build on. How do you approach that, Rachel, as coming into, and Nikki too, coming into a new situation where people have been doing an excellent job at this for a long time, but maybe there are other ways that you're going to approach it?
Yeah, I mean, well, I was lucky. I was able to spend 1 month with Robin and observe. And I always said, what I observed was, wow, this is someone who's given so much to 30 years to an organization. So I observed that and what that meant. But I also, I learned a lot. I said, I got a lot of data from that experience. And so I kind of had to make a decision about, okay, what can our team handle? Not only are they a new person's walking in the building, they've just been through COVID and are still, we still are going through that, but you know, they've had to meet really, to shift and meet some pretty acute needs for 2 years now, and they've had their own families at home, and you know, so kind of had to gauge what changes can I make, what has to happen immediately, and let's take this in steps. But really the first step was forming a relationship with every member of the team and putting that before everything else, because we can't go out and work in our community if we don't embrace some of the same ideals, if we don't respect one another, and all of that. So I had to say, let's make sure, because it's earned, right? So I spent a lot of time doing that. I'm really proud of the team we have. I learn something from our team every single day. That's a cool thing. I'm in a job where you get to keep learning. But yeah, I'm appreciative of how they've had patience with me as well, you know, and said, we communicate, right? Things aren't easy, but we're getting there. And as it turns out, you know, we're coming up on a year and it feels like a different place. And I love that. I love that.
I want to talk about some of the things that CHIP does. One of the things that you all do is to visit people in their homes, which must have been difficult, you know, coming out of COVID.
Yeah.
So you've brought some things here just to kind of visual aids to talk about what kind of things you do when you go into a home. Whose homes are you going to, and why is it important to go see somebody in their house instead of just having them bundle up the kids and come to the office?
Yeah, well, it's a good question. So I'm going to start from this point. A mom, a dad, a foster parent, a guardian, a grandparent might contact CHIP and say, let's start this relationship. A lot of these relationships start with self-referral or a friend who's had a wonderful experience. So each family is assigned a nurse and a family case manager, and they visit them every month in their home. And why in their home? I mean, some of our families have a 1-month-old, and a 3-year-old, and so you know, we visit them. I brought some items that show some of the needs of our families, but every family is different. Every family, some might have more medical needs that we're going to address. Some it could just be that relationship. That's one of the things I've observed is they have such a strong relationship with their nurse and their family case manager. So, you know, we'll bring diapers, clothing, toys every single visit. We bring a book. We do activities with the kids, safety items. We do a lot of coordination of, you know, school is starting. So I'll just say, you know, everyone has just gone back to school. And so, especially for our bilingual families, that paperwork is daunting. It's daunting for me. And so we'll sit down and let's work through that. So it's something that you can rely on. We also offer transportation. So if child has an appointment at the pediatrician, we can come and pick you up, and we can also be an advocate for you and go to that appointment if you feel like you're not being heard. We have bilingual teams, which is amazing. 40% of our families are non-English speakers.
Oh, wow.
Yeah. And of course we have a counseling center, which I might let Nikki talk about because that's
Sure.
one of the things that she's an expert in, so yeah.
Yeah, Nikki, you talked a little bit in the early part about kind of trauma-informed care. How does CHIP approach that in a way that, you know, a doctor's office might not be able to when you talk about seeing what people are actually going through in their lives?
So I think there's a couple of different ways. You know, a lot of physicians are increasingly under pressure to produce large numbers, and they just don't have the time to build that relationship. So, you know, if you're Maybe, you know, if you're like a primary care physician in Roanoke, you've got, you know, 100 patients waiting to see you. They all need to see a doctor. You don't have time all the time to spend 2 or 3 hours really working through some stuff with these patients. And, you know, one of the things that CHIP is really different in is that, you know, you'll have a case manager sometimes for 10, 15 years because, you know, even though the kids age out at 4, there might be a younger sibling and then you're still with that case manager. And so you really get a lot of time to build that relationship and kind of understand each other. And so I think that is different. And I also think that being in a home environment gives a lot of perspective. So for example, autism spectrum disorders are a notoriously tricky diagnosis, especially in special populations like girls under the age of 5. There is a lot of contextual clues that you can get from being in the home environment that you wouldn't necessarily get in an office, because kids are not going to act the same around the person that gives them shots that they do in their home environment. And it can really throw off a lot of the screener tools, especially again if you're looking at something like an Asperger's diagnosis. So, you know, being in the home environment and really getting to see how the family and the kid is interacting in the home environment really gives you a different perspective on things like that you can then work with the doctor's office. So, you know, I think both are equally important. Both can be trauma informed, but it is sort of that other side that the healthcare providers often are curious about but don't get to see.
Right, because nobody makes a house call anymore, and this is
Right.
in some ways kind of filling that gap that you know when I was young, I remember the doctor coming to the house when I got sick.
Yeah.
Asthma has been a specific thing that you all have targeted, and at first when I was reading about it in your materials and everything else, I thought, well, that's, you know, an interesting thing to specifically pick out. But what is it about asthma that gives clues into everything else that's going on in a child's health?
Yeah, I can answer a little bit, and you might have something to add. I mean, again, as Nikki said, when we're going into the home, we may be able to see triggers, environmental triggers. If you're in a doctor's office, you're not bringing all of your equipment with you that you're using for case management. So that's what we do, is respiratory disorder case management. So we can go in and say, you know, we noticed that it's damp, you know, or we noticed that maybe you're smoking in the home, and let's talk about that. We want to let you know how that affects your child's risk of asthma, and just what can we do to manage this. And also, I love how one of our approaches is bringing the family together as a team. Like, let's talk this out, let's put this on the table right now and figure out what role we all play and how we can do this together. So asthma's one of the educational pieces and part of our case management. Of course, I'm sure you looked on the website. There's a lot.
Yeah, there's no shortage of things that you do, but that one just struck me as, and I thought about it as an asthma sufferer myself. I'm like, oh yeah, that has a lot to do with infant health and child health and absenteeism and all of the other things that go along with it.
Yeah.
Yeah, I would second all that, and I would say too, you know, it also helps to catch things like, for example, maybe, you know, when the family was asked at the doctor's office, does anybody smoke in the home? They said no, because truly they don't, but maybe the child care does when they're only there during the day, and they just don't think about it. You know, you're kind of in that moment, and doctor's offices can be very unnerving anyway, you know, and, you know, you just forget things. I also think that it speaks to one of the big benefits of CHIP, which is that, you know, we really work with our families to help them learn how to advocate for themselves at the doctor's office as well. So it's less of a doctor tells you this and you just nod, and then you find out later they didn't really understand and they were afraid to ask a question, or that they felt like there was like negative pushback from the doctor if they're asking a question. You know, it always helps to kind of have a health professional there with you to, you know, help advocate and make you feel less alone or ganged up on. So I think that's something that's, you know, different.
You know, one word that we've heard, you know, the idea of a caseworker, that can have some really negative connotations, right? Especially as people who are in the system, right? If you have a caseworker, it may make people feel like there's something wrong with them.
Yeah.
How do you kind of get through that?
Yeah, we use the word family case manager, and I still think it's, you know, I'll say this, you hear the word—
You're a case then, you know? Like
yeah. I think it's funny, when I started, I saw that and I thought, I've had that same feeling you did. It's funny, you know, when you enroll with CHIP, you go over the paperwork, your family case manager is Susan, but from that day forward, it's Susan. That is the person who comes from CHIP. You begin to develop the relationship. They are someone you trust. They become your friend, and it kind of. So I think it's part of what you see in the beginning, but then it's in the rear view window pretty quickly. But I agree with you. It's one of those things. It's something that you know, a majority of our families face is, you know, that type of feeling. They're scared too with home visiting. Are you coming into my home for, you know, there's different fears attached to that. And so we really address that head on. And we always want to give folks the opportunity to say, you know, do you have concerns? Let's talk about it. Let's talk through things. This is what people do in trust-based relationships. So yeah, we're able to get ahead of it.
You know, people I'm sure look at the cost of a program like CHIP, and then I also think about the fact that so many people who are on the edges of our systems, they don't have a family doctor the way that my kids had a family doctor. They get their medical care often at an emergency room or an ED, emergency department. Nikki, what are your thoughts on how important it is to kind of keep people out of that emergency department when it's not necessary?
Oh, I mean, it's super important for a lot of different reasons. One, I think it speaks broadly to the brokenness of the American healthcare system. You know, we spend, you know, for example, say you've got somebody who doesn't necessarily have a family doctor, can't find one because they're on Medicaid. They go to the ER once they've already had a heart attack, and then it's a $500,000 airlift visit. And that person, we talk a lot about mortality, we don't talk about morbidity. So maybe you didn't die, but your quality of life is dramatically reduced. When if there had been somebody to help you figure out the family healthcare system, had been somebody to help you get out ahead of that, it would have been a $10 a month blood pressure pill. You know what I mean? And like, this is, I think, you know, it's super important both for the cost factors, you know, as we look at an environment where healthcare GDP is, you know, healthcare spend is eating the American GDP, but also is really most important when you look at the individual and how do you keep people healthy. And, you know, when you talk about the hospital setting, hospitals, a lot of times they do the right thing for the right reasons, and that's great, but they're not incentivized that way. You know, you get paid a whole lot more to amputate someone's leg for untreated diabetes than you get to actually treat the diabetes and prevent them from coming there in the first place, particularly if this is somebody who has trouble maintaining office visits or getting in or understanding their medications and things like that. So I think that's, yeah, I think that's in a nutshell why this is important.
And has CHIP demonstrated in the past improvements in that kind of thing?
Oh, absolutely. One of the first steps is let's identify a medical home, which is a term I had to understand, or a dental home when you're enrolled. So do you have a family doctor? No, maybe I've only been going to the ER. Well, let's find a doctor that you trust. And so I'm going to tell you, on several occasions I've been on a home visit and someone said, so I started going to the dentist and I didn't have a good experience. And so the first thing the case manager says is, well, let's find one where you can trust. All right, let's move forward and still have that goal of establishing that home. Because that's
sure. I think those of us who have some privileges, if we don't like a doctor, if we don't like a dentist, we don't like a counselor, we'll go to another one instead of just leaving, right? And so how do you keep people engaged, Nikki, in terms of like, let's not give up?
Again, it's that relationship, right? You know, it's one thing for me to go to a dentist and have a really bad experience and not be excited to go back, but frankly, this just happened, and Rachel refers a dentist, and I'm going to go because I trust Rachel. You know, and a lot of people have that relationship with their case manager. If my case manager says this is a good idea, well, I'm willing to give it another shot.
We've talked about oral health, and now it's just come up. It's on my list of questions. So, like asthma, how does dental health, how does that impact people's overall health? Yeah,
well, post-COVID, we're bringing dental varnishes back. Across the Roanoke Valley, we're seeing a shortage of pediatric dentists. So that's one of the reasons we're bringing it back.
What's a dental varnish?
Sorry, a dental varnish is a coating that's put on the teeth, applied to the teeth, the milk teeth.
Okay.
Yeah, so one of the things with the support of the Delta Dental Foundation is we have a strong relationship now with Bradley Free Clinic. We're hoping to continue that. They're across the street, they're our neighbors, so that's wonderful. So we're able to, especially for some of the caretakers in our families, the adults, set up preventative appointments and then continue those every 6 months. Again, so that way it's not in the middle of the night or it's an extraction, it's a managed relationship. On a weekly basis, we work with our families and say, let's find a dentist for your child. Let's get them in. And it's just one of the many things. You know, it's one of the many topics of conversation when you're going in for your home visit each month.
And how is what you're doing paid for? Nikki, do you, maybe, either one of you to answer this question, but like, where does your funding come from?
We write grants around the clock. We have support from Families for CHIP of Virginia. We have amazing donors. Our donors have been with the organization for, we're working on the annual report right now. It's a thick one. Churches, civic groups, it's pretty endless. And just, yeah, the Roanoke community. And again, you've probably seen, you know, we're in Botetourt, we're in Roanoke County, Salem, Craig County, and Bedford. So we're out there and the community supports us. So we're very fortunate.
And I think the important thing is we don't charge our families.
Yeah, zero.
So yeah, the families will never have to pay for this service.
Yes.
And I know some of your history, and we could have talked about that for a long time, Dr. Pierce,
Yes.
Saint who walks among us, who helped get this whole thing going, and I know
right.
that's been a part of it. We've talked a lot about physical health. Nikki, in terms of, I mean, I get the holistic idea of it, but in terms of mental health, how does that fit into everything else that CHIP does in terms of getting people to get care for their mental health issues?
Well, we actually offer counseling for our families, and unlike most places, we don't have a wait list at the moment. So, you know, families are able, you know, kids that are enrolled in CHIP are able to get play therapy services. Parents are able to get counseling services. So we do offer that. For services that we don't provide, our case managers really work, you know, to help connect families to those resources that they might not have known. You know, because if you're somebody who has Medicaid or you're Medicaid eligible, but you can't get Medicaid due to various legal circumstances, you know, your options are pretty limited. You know, if you got private insurance, you pick the gate and you walk through it. But if you, well, before COVID, I guess, but you know, if you've got Medicaid or no insurance at all, your options are much more bleak. And so sometimes it really takes, you know, we share a lot of resources at CHIP. I mean, most of our dialogue throughout the day is sharing resources. And so, you know, we compile a list of places that people can go and different things like that to really help them navigate that healthcare system.
And what's the role of the medical, I know the medical community has been very supportive of what you do.
Absolutely.
What is their role in terms of with you all? I mean, what do they have to get? Are they providing services at no cost? Are they just agreeing to see your patients? What's the role of a doctor or a clinic in your system?
A lot of different, of course, we have a strong component on our board, our healthcare advisory committee. We work with Physicians to Children, Carilion, and Lewis Gale, of course, and then a lot of smaller medical providers. But not only are they supportive in terms of financially supporting CHIP, but making connections. You know, when we're doing case consulting, meaning we're trying to problem solve on something, that's who we lean on. And you know, if we can't find a provider who accepts Medicaid, well, that doesn't, someone pops up. We work together as a community and we identify those things. All the time, you know, we're also working with the Virginia Department of Health and creating events and resources, not only for our families, but for, you know, the community.
Community at large.
So,
And you know, we haven't talked at all about parenting skills, really. I know there's, again, we could talk for a long time. We have several minutes left, but Nikki, what kind of things do you do that maybe somebody doesn't have a problem, they could just use some help with their parenting skills? What resources are there for them?
Well, we do all kinds of education about that, and I mean that addresses everything from safe sleep and how do you go about that to car seats. You know, the vast majority of car seats are not installed correctly, and so you know we have resources for a lot of those things. But I think one thing that really comes up that's interesting is, and I've seen this be particular to Roanoke, is, you know, school paperwork is like brain surgery. And you know, everybody kind of needs a little help with that, and luckily the case managers do it so much. They've got it down like the back of their hand because they're helping 40 people do it at the same time. But also things like understanding IEPs, you know, individual education plan, I think is what that was, school. You know, I have seen even mental health professionals and struggle to, you know, come to a consensus on that or understand how to implement it or what that really means for their children. And so being able to partner with their families and help them understand that, help them advocate for their children, help them communicate the challenges and things like that that they're seeing, I think that's a really important service that CHIP provides.
Just decoding that paperwork, and it always frustrated me when my school division where my children went, everything was on paper, and every year you had to do it again, and I'm like, why is this not computerized?
Yes.
But anyway,
Yep.
believe it or not, that's our time. We have, and we could talk for a lot longer, but if you would like to know more about how you can get involved with CHIP, I highly recommend a visit to their website at chiprv.org. While you're online, we'd also appreciate it if you'd go to Blue Ridge PBS Echo and subscribe so that you can be in the loop when we add new content to our on-demand video library like this program. For What It Takes, I'm Tom Landon.